Welcome. Thank you for joining us today at PSHSA's Return to the Workplace conference. And thank you for joining us this afternoon for this session on developing and implementing a psychological health and safety program to support your workers as they return to work amidst COVID-19 and beyond. My name is Tegan Slott. I'm a health and safety consultant with Public Services Health and Safety Association, working with health and community organizations in the Ottawa area, and I will be facilitating this session. I hope you've had the opportunity to listen in on a few sessions throughout the day. There have been many wonderful speakers speaking to the effects of COVID-19 and strategies that workplaces can use to support workers' mental health. Dr. Vivian Lee spoke about how employers can decrease anxiety and optimize a successful return to work for employees. Dr. Bill Howitt spoke about workplace innovations and emerging solutions to support employee mental health during this pandemic. And Dr. Michael Ungar spoke about the importance of resilience as workers and leaders navigate return to the workplace during COVID-19. This session will focus on taking an organizational approach to program development and implementation, working within a health and safety management system. We will explore the notion of psychological hazards as just another hazard, whereby we may identify, assess, control, and evaluate the hazard in a similar manner to other workplace hazards such as musculoskeletal disorders, chemicals, or biological hazards. We will look at psychological hazards in the workplace and more specifically, what job factors may have an impact on workers' psychological health. We will begin to look at controls that can be used to mitigate risk of psychological injury and illness in the workplace. We will also look at taking a prevention, intervention, and recovery approach to design a comprehensive psychological health and safety program based on your current and future needs as an organization. Now, why should workplaces, especially those in the public services, look to recognize, assess, and control psychological hazards? Well, because they're a significant hazard. Within the past few years, we've recognized that exposure to traumatic events by first responders has a significant impact on workers' mental health. Presumptive legislation was passed in 2016, presuming that should a first responder be diagnosed with PTSD, the cause may be directly attributed to work-related exposures. First responder organizations are required to develop and maintain policies and programs for PTSD prevention. This is a fantastic step forward in protecting the mental health of our first responders in Ontario. But exposure to traumatic events are not the only job-related exposure that impacts a worker's psychological health. In frontline community work, we've got a lot of words to describe a very similar phenomenon. Secondary trauma, vicarious trauma, burnout, compassion fatigue. They don't have quite the same birthplaces or implications, but frontline workers use them pretty interchangeably. We're trying to describe the emotional, physical, and mental toll that being exposed to human suffering and oppressive systems can cause. So how do we mitigate risk of exposure? When considering psychological hazards in the workplace, we can look at organizational hazards and job-specific hazards. Organizational hazards are fairly widely known and understood to be 13 psychosocial factors that can positively or negatively impact employees' psychological health. These include the way work is carried out and the context in which work occurs. Specifically, the 13 psychosocial factors are psychological and social support, organizational culture, clear leadership and expectations, civility and respect, psychological demands, growth and development, recognition and reward, involvement and influence, workload management, engagement, balance, psychological protection, and protection of physical safety. We can identify and control these hazards in a variety of ways. There are many tools that are created specifically for this purpose. Stress Assess, developed through OCOW, the Occupational Health Clinics for Ontario Workers, and Guarding Minds at Work are two survey tools that take a more global approach to identifying the overall state of an organization as it pertains to the 13 psychosocial factors and beyond. In addition to identifying organizational hazards, it's important to recognize that job-specific factors exist that may contribute to the mental health or mental ill health of the worker. Safe Work Australia defines psychological hazards as anything that increases the risk of work-related stress. We'll take a closer look at these factors shortly. We know that a psychologically unsafe workplace has a negative impact to both employers and employees. The impact to employers may be increased absenteeism, increased short-term and long-term disability claims, increased health insurance claims, job turnover, potentially litigation, increased presenteeism, and incivility and the incivility continuum. From an impact to individuals perspective, a psychologically unsafe workplace may negatively impact individual workers by contributing to decreased job satisfaction, increased physical illness, such as certain cancers, musculoskeletal disorders, or infections, may have a negative impact on sleep, negative impact of family life, and general increase in mental health by moving from the green to the yellow to the orange to the red along the mental health continuum. What is the impact of COVID-19 on psychological health and safety in the workplace? Or what could the impact be? Well, we know that the impact may be related to work-related factors or personal factors in our workers. For example, work-related factors may be increased exposure to workplace hazards, such as biological hazards, of course. A change in work hours, we might see an increase in work hours or conversely a decrease in work hours depending on what organizational need is. Potential work outside of scope of practice due to changing in work environments or work demands. Decreased communication. Many workers are now working remotely from home-based offices and don't have the same communication lines or communication means that they may have in a regularly established workplace. There may be unclear leadership expectations as we transition to a time of uncertainty. There may be blurred lines between work and home life. From a personal perspective, there may be multiple demands on working parents, increased cognitive demands or the mental load, having to juggle both home life and work life within the same work environment. We may have reduced access to childcare if we are still working outside of the home and our childcare providers have changed or are no longer available to us. We may struggle with social isolation. We may have decreased mental health support. Many workers find mental health support among their peers in their workplaces and build social supports within the workplace, which they may no longer have access to. There may be anxiety over uncertainty. There may be the inability to access or care for our loved ones. For example, elder care may become a challenge. There may be exposure to domestic violence in the home. We're spending a lot more time together. And there may be increased risk of chronic mental stress. It's not all bad news, however. A psychologically safe workplace provides many positive impacts, both for the employer and for the worker. Research shows that an organization that puts in place a psychological health and safety program will see a yearly return on investment of $1.62 for every dollar invested within the first 3 years, and $2.68 for every dollar invested beyond 3 years. A psychologically healthy and safe workplace can foster a safe and supportive work environment so that organizations can in turn support their own clients and provide excellent care. There's also increased employee engagement. So how do we achieve a psychologically safe workplace? Well, we take an organizational approach to hazard management, just like we would do for any other workplace hazard. What does that look like? How are psychological hazards just like any other hazard? Let's take musculoskeletal disorders as an example. MSDs in and of themselves are not a workplace hazard. It's job-related factors such as awkward postures, force, and repetition that alone, or in some combination, contribute to the potential development of a musculoskeletal disorder. We also know that not all workers are affected equally by the same exposure to these job factors. Worker capacity varies based on things like age and physical condition. Now let's look at psychological hazards. There are many job factors that, when we take a closer look at workplace claims data, have been shown to impact a worker's mental health or contribute to psychological injury. These are things like work hours, workload, autonomy, leadership expectations, communication, level of cognitive demands, and exposure to emotional situations, just as some examples. And just like musculoskeletal disorders, workers all have various capacity for exposure based on, for example, level of resiliency, support systems available, and so on. So treating psychological hazards and their contributing job factors, just like any other hazards, we can take the same approach to recognize, assess, control, and evaluate the hazard. We can do this both at the job level and at the organizational level by using a strategy based on an occupational health and safety framework. We want to consider both individual factors in recognizing, assessing, controlling, and evaluating the hazard, as well as organizational factors. Today, though, during this presentation, we will focus primarily on organizational factors. We want to recognize the physical, cognitive, and psychological factors that may affect mental health. We can do this, for example, by auditing and by implementing a psychological health and safety program. We want to assess the risk factors, so assess organizational, physical, cognitive, and psychological factors that affect mental health, and implement organizational controls for recognize organizational factors that affect mental health. Finally, we want to know if our control strategies are effective by reviewing our KPIs and organizational metrics for psychological outcomes. When we take an organizational approach to hazard management, ideally, we look at prevention, intervention, and recovery program elements. This is a really busy slide with a lot of information. And although it can seem overwhelming, organizations can begin by implementing key program elements based on their unique organizational need. We want to identify which components may be already in place in an organization and which may be most beneficial for implementation right now and down the road. Is your organization ready to take a wholesome approach to program implementation? Do you have an existing comprehensive health and safety program in place with risk management, safety management, training and education, incident reporting and investigation, incident response and return to work elements? Can you use your existing framework and add in any pieces specifically related to psychological health and safety? Or are you just getting started and have an immediate need in a particular area, such as peer support or return to work? Let's take a closer look at these program elements. Prevention focuses on outlining the basic elements of psychological health and safety management, such as understanding legal responsibilities, recognizing, assessing, and controlling the hazard, developing policies and procedures, outlining roles and responsibilities, and incident reporting procedures. The goal is to establish or integrate psychological health and safety prevention practices for the promotion of a psychologically healthy and safe workplace that actively works to prevent harm to a worker's mental health. Prevention involves safety management, including key elements such as senior leadership commitment and policies and procedures for psychological health and safety. Prevention also includes risk management. Some key elements might be identifying organizational psychosocial risk factors and job-specific psychological risk factors. If we take a closer look at what a job-specific psychological risk assessment might look like, we would want to identify, assess, control, and evaluate job factors that may contribute to psychological injury or illness. A job-specific psychological risk assessment guides development of an action plan to control the exposure to the risk factors and provides more immediate workplace controls at the worker level. If we look at job-specific factors that may contribute to injury or illness, these may be things like working time, workload, high levels of cognitive demands, clear leadership expectations, work environment, working alone, exposure to workplace violence or workplace harassment, exposure to chronic mental stress or traumatic mental stress, exposure to vicarious trauma or secondary traumatic stress. Having the adequate knowledge, skills, training, and ability to complete the job task. Working outside our scope of practice, having a high effort or low reward job, autonomy at work, communication, working with vulnerable populations, considering the physical safety of the worker, and having adequate job resources provided. Here's an example of what this might look like. This is an example of a job-specific psychological risk assessment. This tool provides guidance on how to identify job-specific risk factors, rate associated risk using a risk matrix, and provide suggestions for controls and potential solutions to mitigate risk. So for each one of the job-specific factors that may contribute to psychological injury or illness, there is a description, a hazard description. So in this example, we have working time. Working time may include work hours, shift work, unpredictable work hours, rigid scheduling, or the lack of flexibility, and look at work-life balance, or the inability to maintain work-life blend, required mandatory overtime, or no advance notice on overtime. For each of those job-specific risk factors, or contributing factors, we would identify risk as high, moderate, low, or very low using the risk matrix on the top right-hand corner. Should the risk be identified as moderate or high, or should the risk be considered an organizational priority? The tool also provides examples of controls that we might want to implement at the organizational or job-specific level to mitigate risk. So in this example, we might want to consider flexible work arrangements, provide adequate support for shift workers, encourage use of allocated time off, and develop parameters around working during off hours. So we have controls that we may want to put in place, and the tool also provides potential solutions on how to implement those controls. Not all these solutions are going to be workable for all work environment, but it's a great start to looking at identifying your risk factors and putting in place controls to mitigate risk. Other important elements to consider when looking at prevention of a psychological injury or illness at a program level are incorporating psychological hazards into workplace inspections and ensuring that appropriate training and education on mental health is being provided to workers to promote an open, psychologically safe culture at all workplace stakeholder levels. This is an example of a Joint Health and Safety Committee inspection checklist that incorporates specifically psychological health and safety hazards during the inspection. Of course, not all of our inspections are Joint Health and Safety Committee monthly inspections, but it's a great start, and it can be adapted for other inspections, workplace inspections, completed at the supervisor level, for example. The next group of components in a psychological health and safety program focuses on intervention. Intervention focuses on outlining actions that can be taken to improve a situation. This includes that workers know how to respond and manage psychological events or report psychological injuries when they occur and are supported in doing so. It also highlights intervention options that are evidence-based and that can be utilized in organizations. So intervention supports might include our incident response, our worker supports, supervisor response, and peer support fits nicely into an intervention program as well. Finally, it's important to consider recovery after exposure. The recovery and return to work ensures that managers understand how to accommodate a worker who is suffering from a psychological health and safety concern, and there are clearly established roles and responsibilities for supporting workers through this process. Recovery and return to work is an important aspect of preventing future or further injury. Recovery may include such things as training and education on supervisor responsibilities for return to work, including return to work for psychological injury or illness, and stay at work. Also includes worker responsibilities, training on worker responsibilities for return to work, because often we as workers don't know our roles and responsibilities for general return to work in addition to psychological return to work. We also need to consider post-incident response and stay at work and return to work after injury. So what does prevention, intervention, and recovery look like in the context of COVID-19? How can we apply elements of a psychological health and safety program to mitigate risk of psychological injury or illness to workers as they return amidst the pandemic? If we recall, some of the work factors that we considered as being changed as a result or affected by COVID-19 are things like increased exposure to workplace hazard, change in work hours, possible work outside of the scope, change in work environment, decreased communication, and so on. We can take individual program elements from risk management, for example, and apply them specifically to mitigate risk for our workplace factors that may contribute to psychological illness or injury. For example, if we have increased exposure to workplace hazards, and the example here is just biological hazards, but of course there could be increased exposure to different kind of hazards if we're working in different work environments, we would want to take a risk management approach and consider our hazard recognition, assessment, and control for not only our standard hazards such as MSDs and biological, chemical, physical hazards, but also take a look at doing a risk assessment or considering risk management for our psychological risk factors. If we have the potential for unclear leadership expectations because we are in a dynamic work environment, our work environment is in the process of changing almost day by day, it seems. Maybe we take a safety management lens or approach and we consider looking at our policies and procedures and adapting our policies and procedures and the way that we communicate to ensure clearer leadership expectations and have well-established leadership commitment for the mental health of our workers and psychological health and safety within the organization. Perhaps a decrease in communication can also be addressed by a peer support program. When we consider personal factors, we consider that not only do workers have changes in job factors to navigate, but also likely changes in their personal or home factors to consider. These could be multiple demands on working parents or increased cognitive demands, a struggle with social isolation, decreased mental health support. We can mitigate potentially personal factors by looking at peer support programs to put in place, perhaps to address anxiety over uncertainty or to address decreased mental health support. Like we discussed earlier, workers may rely on coworkers in the work environment for that social support, that social network, and may have decreased mental health support. Well, perhaps we may want to, as an organization, look at creating a peer support program to have in place so that we maintain that level of social support and peer support, especially in response to workplace incidents that may occur where we don't have a formalized system in place. We also may want to consider worker supports in the form of community supports and treatment, what's available out in our community. So if we don't have, as an organization, an employee and family assistance program in place, an organization can certainly take a look at what community-based supports are available and out there and communicate that to our workers so that they are able to access those supports. A workplace, should it be feasible, can also look at implementing an employee and family assistance program and look at psychological benefits to their workers. This may be a good time to evaluate what your psychological benefits are to our workers. Are they sufficient? Have we completed a job-related or job-specific workplace assessment and identified the potential exposure to psychological hazards? And if there is substantial risk there, are psychological benefits adequate? Perhaps, perhaps not. Perhaps that's something we want to take a look at. We may also, depending on the exposure, want to take a look at specialized internal support response to psychological hazards. And that's not just related to COVID-19, but moving beyond COVID-19 as well. So moving forward and supporting our workers beyond COVID-19, how do we continue to move forward and continue to support our workers and our leaders beyond COVID-19 and as we progress? Well, we're back to our psychological health and safety program and taking a continual improvement approach. We start by picking a few items from this buffet of items that you see in front of you that might seem a little bit overwhelming at first, but the idea is not to swallow the elephant whole, but rather to pick and choose the elements that make most sense to address at the time based on what our organizational need is. And how do we determine what our organizational need is? Perhaps it's doing a job-specific risk assessment, or perhaps it's looking at taking a more global organizational approach to the 13 psychosocial factors. Perhaps it's going through a psychological health and safety program checklist and looking at what we already have in place and what our missing pieces are, what our gaps are, and what our priorities might be as an organization. Is it peer support after exposure to a traumatic event? Is it getting a baseline of organizational culture and psychological health by evaluating our 13 psychosocial factors? Is it getting a better understanding of job-specific psychological risk by completing job-based psychological risk assessments? That's up to you and your organization. Once we start to put elements of a psychological health and safety program in place, we want to ensure that we keep working on it and there's continual improvement. Ideally, we want to be doing a program audit annually or every couple of years for continual improvement. There is a wonderful audit tool in the CSA standard for psychological health and safety in the workplace, the CSA Z 1003 at the back of the standard. It's a great tool to use to take a look at overall auditing your program and looking at where your gaps are and where you want to move forward. PSHSA also offers multiple checklists and guidance for the implementation of a psychological health and safety program. Ideally, your psychological health and safety program based on prevention, intervention, and recovery fits nicely into a continual improvement framework, into a health and safety management system that you may already have established or that you may want to look at establishing, taking a plan, do, check, act approach. Thank you for listening today. Happy to take any questions, and please feel free to reach out to me for further information or connect with your regional consultant at Public Services Health and Safety Association.